So I'm here today with Dr. Deb Toraca with Wizard of Paws up in Mystic, Connecticut. And it's such a delight to be with you again because you have this wonderfully well-rounded approach to modalities. You work with a lot of different, very high-end practice animals and athletes and all this good stuff. And so modalities are so important to you. Your hands, your touch, your feel, your observation, your sensitivity, but then the ways you can bring in these other tools to help your patients get better faster. And so today we're going to talk about shockwave and a particular flavor of shockwave. But as if you were in the audience listening, what would you want to know first to kind of set the table on shockwave, what it does, what it's best for, how it's working in your practice, and adding that extra element that you love, because that's one more thing that can benefit your patient. So kind of give us a quick recap and then we can go into more specifics. And again, thank you so much for taking time with us.
Oh, sure. Then thank you, Mark, so much for having me as well. And yes, I feel like I've been doing this for quite some time and I've seen things come and go and as far as modalities and what works and what I feel comfortable with in my practice. And I was actually first introduced to shockwave maybe 20 years ago,
Hmm.
and it was an electro hydraulic unit, and the animal needed to be sedated. And first testing it out, I used my own dog and we sedated her. And I will never forget, while I was treating her, she was actually whimpering, even though she was sedated. And that just stuck in my mind that, wait
Hmm.
a second here, I'm causing pain. And that just seems completely wrong, from what I'm doing. And, so I kind of put shockwave off of my radar. And then as there were changes. I was introduced to a piezoelectric, which is a different sort of shockwave, a little bit more focused and targeted, and learned that this does not need to be painful. So then I said, aha, we can get all these benefits of shockwave, because shockwave really started with back, I think, in the 1960s with people and utilizing it to break up kidney stones. And people incidentally noticed at the same time that their back pain was gone.
Hmm.
So then, of course, started to look at this and could this be a therapeutic option as well? So, looking at the therapeutics and starting to understand a little bit more, started using the piezoelectric unit, and with kind of negating that misconception that more is better. I think sometimes the term shock wave is misleading because it sounds like, you're giving this patient a literal shock, and that's not it at all. And learning that it can be very comfortable for patients and very easy to administer. I always look when I'm treating an animal with shockwave, even some of my very active police dogs with maybe an iliopsoas injury, which is quite a difficult area to get into with an intact male dog, and they're calm about it. And I'm getting all the benefits that I'm looking for. Um, and adding this kind of to my tools. And of course, me looking at the proper diagnosis and making sure we're treating the actual area that we need to be treated. And shockwave is another tool allowing us to focus in on that. And it's great for soft tissue injuries. I had mentioned iliopsoas injuries, bicipital tenosynovitis, patella tendonitis, um, also with fracture healing. So fracture repair. There was a nice study demonstrating utilizing shockwave after a TPLO and the healing of the fracture site. So lots of other, benefits that, we may think about adding in. And of course, with our family of multi radiance lasers, what multi radiance is known for, laser fits right in there. And very often, if I think that the animal may be sore or painful after, I'm sending the owners home with a MyPet laser so they could treat at home. So it fits in, just so nicely, with
Mhm.
everything.
That all makes sense.
Yeah.
Just to give our audience just a recap of specifically what's happening when these pressure waves are hitting with these various
Yeah.
different applicators that you have
Yeah, sure. And
at the
what
tissue level.
Yes, and with the piezoelectric. So, just going back to if we think, shocks and booms are present in our atmosphere all the time. When the Concorde took off, we had that sonic boom, lightning, things like that. So you get this pressure wave that goes into the tissue. And the piezoelectric, the actual head, has piezoelectric crystals in there that are emitting the shock wave. And this is different than an electrohydraulic shock wave, which many people are used to hearing the loud popping noise. And there's a spark plug in there, and that's actually what you're hearing. And the difference with piezoelectric is it's a little bit more direct or focused, whereas the electrohydraulic is more spread out. And when you have this mechanism of action that sort of hits when the shock wave is going in, you're stimulating potentially new blood vessels, you're regulating inflammation, you're releasing that good nitrogen monoxide, we're getting the bone metabolism and healing. And as I said, looking at bone growth and, fracture repairs and all of that. So we're causing a little bit of disruption, creating a little bit of inflammation, but then accelerating that healing process there. So, which is lovely.
So instead of a spark plug ignition, which we can all relate to very easily, just going back
Right,
to a car,
exactly. Yeah.
we're looking at these crystals, which is so fascinating. And I understand there's like 200 elements in there.
Yes.
Can you
Yes.
can you give us a visual picture of the difference? I can imagine a spark, but
Yeah.
how's it working with these crystals and what kind of crystals?
Yeah, so there are piezoelectric crystals, and there are in the actual head, and the head can be 25 millimeter, 40 millimeter, 100 millimeter. So just of course, looking at the surface area, and these crystals are just forming this pressure wave. And with the piezoelectric, the noise that we hear and what the animal hears is actually very low level. So it's sounds like a ticking noise. And we set the intensity and the frequency specific to what we're looking at. But the ticking noise is not noxious to the animal, not noxious to the practitioner or anybody around. Um, so, with that sound wave that it creates, it'll direct and focus this pressure wave into the body, causing a change in the tissues. So there's actual disruption of the tissues. And depending upon what gel pad is used, the gel pads can penetrate anywhere from 25 millimeters down to 5 millimeters. And again, looking at a 5 millimeter head may be utilized on the biceps area. The 20 or 25 may be utilized on a Great Dane's hip area as you're shock waving potentially for hip dysplasia or after an FHO or anything like that. So, and it allows it to target. I often use, and I keep cupping my hands, but when we look at the actual gel pad, we'll look at exactly how deep we're going in. The higher the pinnacle, the lower the depth. The larger the pinnacle, the deeper the depth. So we're able to decide.
So is it fair to say then that mechanically these are very different, hence the difference acoustically? But from
Mhm.
a mechanism of action perspective, they're quite similar in terms of the nitric oxide, the ATP. So mechanically
Correct.
different, difference in sound, but that has no correlation to effectiveness because mechanically it's different.
Correct, correct. And a lot of getting back to like my original thought process 20 years ago with the shockwave and understanding again, like we're all in this to make animals better. And yes, sometimes we have to cause some discomfort, but how realistic is it to, especially in a rehab setting or um, maybe a setting in a hospital where the hospital doesn't have the ability to sedate and then monitor an animal coming out of sedation, um, to apply that and looking at that multimodal approach. So can very often animals come in to our clinic, they're reassessed, they receive shockwave to their applicable area. And I always joke that they're down on their nice bed, licking peanut butter or doing whatever. Um, we're stretching after that. We may apply laser in the clinic with one of our handhelds or our alphabet, but then we're progressing them along to the continuum of that multimodal approach. So exercise, specific, whether it's the underwater treadmill or targeted therapeutic exercise. And so there's no downtime with regard to, getting them up from sedation, letting them recover, or being so painful that they can't function after, even if they are not sedated. And again, I think that's a huge component. That works nicely, in my clinic, in my setup, even in the barn. I find that horses respond incredibly well to this. I shockwaved a donkey with hip dysplasia over the weekend, and he could care less. He was eating his hay and, you know, doing great. And the owner said he felt so great, he jumped over a fence right
Yeah,
after I'd seen him. So I said, "Oh, okay."
his own little celebration.
Exactly. But he felt pretty good.
So fair to say then that you've not only reduced the threshold of trauma because of the sound and the impact and like a snapping rubber band by using
Correct. Correct.
piezo instead, but you're
Yeah.
also mitigating in some cases perhaps the need for surgeries and that level of trauma from that because you're able to heal things that might have required surgery have they not been intervened when you get to it. Is that fair to say?
Correct. Absolutely. Absolutely. So definitely.
Great.
Yeah.
And so how about so the donkey is a great case.
Yeah.
How about some of those sport canines that you have, where these traumatic cruciate injuries and all the working and the
Yeah.
torquing that goes on? How have you been really impressed yourself with shockwave
Yeah.
in general? That's been amazing to you. And then maybe you're seeing a little different, interesting result with the piezo that you're using now with the Impact Vet.
Yeah. So, and I've been using our Impact Vet. We had just released it, but I've had one of the prototypes for a little over 6 months now.
Okay.
And so that's been, just a joy to use and very user friendly. But so mentioning the sporting dogs and a lot of the working dogs, a lot of them sustain or just accumulate soft tissue injuries. And the iliopsoas is one, the biceps, tenosynovitis. And I feel that a lot of times practitioners never get them to the end result. And I think a lot of it, and this was a concept developed a long time ago by a physician named James Syriacs. And when we look at any kind of tendon inflammation, so normal tendons lie in parallel with each other, or the fibers lie in parallel. And when there's inflammation, it's almost like we took a box of toothpicks, threw them on the ground, and those fibers now are laying in all these different directions. And we can get in manually and do deep friction massage, which is quite uncomfortable. Or we can get in and apply shockwave, which will cause the fibers to start to realign. And that is ultimately how we're going to return the animal to full function. Once we get that, reduce that, inflammation there and get those fibers realigned, we can strengthen appropriately, eccentrically and then concentrically. So start to get them stronger and start to return. And I find we see so many cases that they haven't gotten better, they haven't gotten better, and we're kind of the last straw. And with these soft tissue injuries, and I find that shockwave has just been incredible, to get them and return them.
Well, that's very interesting because you bring up on the one hand how these fibers can be distorted and all out of alignment. And then we talk, of course, with laser about how we can grow new collagen, but it's so important that those fibers have the proper alignment to
Hmm.
preserve tensile strength down the road, rather with a horse to rebow it. So not
Absolutely.
only correcting the alignment, but then preserving that as you're growing new collagen fibers as well. Is that about it?
Correct, correct. So, again, with just promoting, all of the good stuff, as I tell my owners coming in and, definitely improving that tensile strength and restoring the tissue to as normal, as can be. So maybe the tissue is not going to be 100%, but it's going to be 98% and well enough to get there.
Well, isn't it incredible how we're using sound and light waves
Yes.
more and more? We're reminded what Tesla said, what Einstein said, right? It's amazing how we're using the vibration, frequency, all these ways to heal
Yep.
naturally
Right.
with the body. It's incredible.
Yeah. Absolutely. Absolutely.
Now, a difficult species oftentimes, of course, are the felines. Now, I know that's not a
Hmm.
major part of your practice, but you
Yeah.
get some as well. And
Yeah.
one of the things we love about our lasers that you can, I've had people hand me a cat and say, this cat couldn't take it with a class 4 period, very skittish. I said, let me have it. And I start to do that unwind and it just melts like
Yeah.
butter.
Yeah.
But for
Yeah.
the acupuncture people, they say it's difficult with some cats to get those needles going down the leg because they just don't like that at all. And the whole
Right.
experience of coming to the vet.
Right.
Are you seeing similar successes because this is less traumatic as a shock wave for these
Yeah.
cats as well?
Yeah. And Mark, I mean, I love cats, but my philosophy usually is in the office, like, oh, let's send them home with a MyPet laser and bye-bye,
Right, right, right.
Um, but we have a couple cases in right now. One had an FHO or femoral head and neck osteotomy for hip arthritis. And surprisingly, the cat is, she's a great cat to begin with, but tolerates the shock wave without a problem, purrs actually while it's on. Um, and we have another uh, little, maybe a year and a half abuse case, and the little cat had a radius and ulnar fracture, and we've been utilizing shockwave to help with the fracture healing. And this was a street cat, and actually also handles it really well, and is very we try to take a fear-free approach, and we want the animal to be as relaxed as possible. And they've been doing great with it.
Wonderful.
Um,
So
yeah.
for all the people that might be hearing this thinking, sounds interesting, sounds very compelling.
Hmm.
I'm seeing shockwave in one perspective. I'm seeing these different heads for different penetrations up to 5 millimeters.
Yeah.
But now let's go to the buttonology, the menu. How do you
Hmm.
decide what to do? How complicated is that? Is it tricky? Is it
Yeah.
going to be something else to be difficult as a threshold to get over? How does that part work?
Yeah. So, and there's definitely a lot of research out there, and you just have to look at the research on what type of unit they're utilizing. So, is it the electrohydraulic? Is it the piezoelectric? Um, and then we know basic settings, and I always say that we have to deal with skin impedance, hair. We're using ultrasound gel. Ultra air is the enemy, especially when we're placing the pad into the piezoelectric surface. So ultrasound gel needs to be placed on. I don't shave the animals at all. So we
Important.
use, yes, we use a lot of ultrasound gel. And then I think one of the misconceptions, and some of the gentlemen I teach with have, and even some of my staff members have had contests who can take the shockwave at the strongest.
Mm.
And I actually find less is more. So again, that relaxing, almost like just a tapping motion, the animal may feel. Again, they usually get that glossy-eyed look within 30 to 60 seconds of treatment. We can set the frequencies, so the literal frequency of the pulses, the higher we're utilizing more with tendinopathies, the lower more with bone healing and things like elbow and hip dysplasia. So once the basics are down there and you can start to fine tune that, again, looking at a Rottweiler is going to be a little bit different than treating, let's say, a blonde Frenchie. Just again because of the thickness of the skin and everything else. So, we definitely there are guidelines out there, and I always encourage people, yes, look at the guidelines because we never want to do any harm, but then decide what works best for you. So if I'm treating a stifle, I may decide to hold 4 points on the stifle or move around the distal hamstrings initially to get the animal to relax. So, kind of fine tuning what is going to work best for you and for the animal.
Mhm. So we have this correlation on the laser side. We say, well, how large is the animal? How
Hmm.
chronic is the injury?
Yep,
And how old is the animal?
sure.
Helping us to determine the number of times it will need to be treated to get the result. And then there's the issue of light skin pigmentation, gray to black skin
Right,
pigmentation. How do
right.
those correlations translate over into shockwave? If at all,
Yeah.
how is it different or the same?
Yeah, so no, we definitely have that consideration because the total dosage that we utilize with, again, a smaller dog is going to be much less than that larger dog. So maybe we will utilize 250 to 400 pulses for that Chihuahua and maybe up to 2,500 to 3,000 for the same condition in a Great Dane or German Shepherd. Um, so we'll look at that. And the same thing with, again, those darker coats, the thicker coats, and looking at maybe turning the intensity up a little bit more, and paying attention to that.
So it's something that you could say is roughly proportional. It's not a magic. It's
Hmm.
depending on the size, depending on the color, and you start to
Correct.
get those proportions in your mind about how many pulses you're going to need for a given condition.
Correct.
But what about the menus themselves? We have these heads, we have the technology. How easy is this unit to use? The ease of use interface for the panel. How is that relative to other
Yes.
units? And do you find it easy and nice to train others?
Yeah, I've actually, all the units I've used, I think this is probably the most user friendly. So once the machine is turned on, we can choose whether we're treating a cat, a dog, a horse. And then once into that screen, it is going to allow us to choose the area or the condition that we want to decide which head we're going to use. So it may give us a couple options and then give us and I don't want to say a protocol per se, but a guideline, for X amount of pulses set at this intensity and this frequency. Of course, that can always be adjusted manually, but it gives us the guideline. And so it is very easy to use, and just kind of go in there, punch the buttons, and what's going to work the best.
Mhm. If you were looking at these in parallel, would you say it's about the same number of treatments, shockwave versus laser, when they're complementary together, or not?
Yes. Yeah. So I think with shockwave, we may have a little bit less of treatments. Um, with laser, we have so many options of looking at, improving strength, improving range of motion, and all of that. So, I may utilize laser later on in rehab if I'm targeting a specific strength. For example, maybe I'm working on the quadriceps and, trying to get that motion back, there. So I'd probably say a little bit less if, I was treating a dog for 10 sessions, maybe they would receive 5 to 6 shockwave visits. And again, it's all, you know, patient dependent. Definitely had animals that 3 visits work, they're doing great, and we proceed along that multimodal approach.
And are the contraindications roughly the same?
Contraindications, yes. So we want to, of course, any area of undiagnosed pain, cancer, and when we look at any malignancy, certainly if let's say, an osteosarcoma amputation on a forelimb, you can treat another area in the body. So, for example, we're working with a dog right now that had an amputation due to an osteosarcoma, but has awful hip dysplasia. So we're treating with shockwave. The other areas you don't want to go over any area that can cause cavitation. So over the lungs, we don't want to do that.
Okay. And with pregnancies around the womb?
Pregnancies, same thing. And that would be another contraindication directly over the uterus, but you can treat elsewhere as well.
Great. So any of our vets in the second or third trimester and their feet are killing them, not a problem.
All good. All good.
Great. And if you had to say where certain conditions are better for shockwave or better for laser, like on the issue of uh, bone fractures,
Mhm. Yeah, so I
getting a
would
little
probably,
bigger depth of penetration with shockwave or
yeah, and I would say, I always think, okay, what's going to work best, at this particular time. And if I have a soft tissue injury that's incredibly painful, I'm going to opt for my priority principle initially, reduce that pain, and then maybe utilize shockwave once that pain is under control. So second, third visit. Um, if area is more chronic, so soft tissue injury that's more chronic, I may go for the shockwave first. And as I had mentioned earlier, utilize the MyPet laser for home care, if there's any pain or discomfort created there. And same with, I would think, chronic hip dysplasia, OA, elbow dysplasia, that sort of thing.
so fair to say that you're kicking those chronic conditions back into the acute phase?
Correct. Correct.
Mhm.
Correct. And
And
I'm sorry, one of the, which I always um, just assume, but with one of the contraindications or precautions. So we don't want to go directly over the spine. We want to, I always say, come in indirectly, like we're coming in at on those facet joints instead. So just not coming perpendicular down.
okay. And it can also be effective about lesions along the spine by coming
Correct. So often those lumbosacral stenosis cases and those chronic facet joints works fantastically.
in. Super. Well, it sounds very interesting. And of course, how nice is it to be able to have a laser that you can send home afterwards
Oh,
and
yes.
keep the healing process going?
Correct. And, it falls right into because so often, especially with these chronic conditions, owners come in and, they've been to all these places, they have this diagnosis, and they want to know how many visits. And I'm very honest and say, what I do is important. What you do is more important. So, I highly encourage utilizing the home laser because that's going to just facilitate the entire process.
How often have you and the staff had a patient come in, they missed an appointment or two, and you
Mhm.
can see they've dropped, and you've got to build them back up again? But if they
So
had just been able to continue it at home, that patient would have been able to continue that trajectory rather than drop.
absolutely, so often, and unfortunately, we're in the winter in New England, so with weather delays or the flu, or sometimes people just have to miss appointments. But unfortunately, then there is a drop, there is a decline, and now that's going to take us longer to get to our goals.
Mhm. So how nice that among your modalities, the shockwave may not be able to go home,
Mhm.
but the laser can, and it's
Mhm.
just so easy to use.
Absolutely. Absolutely.
What one thing stands out about the impact vet above others relative to other, because vets are looking at a wide panoply of products available these days. There are so many. What would you say are the one or two things that set the impact apart most in your mind that
Mhm.
would be compelling for that vet looking at the purchase options?
Yeah, I think the ease of use is, definitely of all the units that I've tried or looked at, definitely easier to use, and the price point as well. So for all of what you are receiving and the quality that you're receiving, the price point is fantastic as well.
Any give
And
up on, sorry?
Oh, I'm sorry. And something else that maybe is not spoken about with the electrohydraulic units is that there's a certain number of shocks the unit has, and then they need to be refurbished. And purchasing those new shocks can get quite expensive. And that is not anything that we have with our impact unit. I believe the unit can take up to 5 million shocks before it's suggested just to be looked at and tuned up. But 5 million
You,
is quite a bit.
you read my mind. That's exactly where I was going. Useful life. And
Yes.
5 million is a lot of shocks. On average, how many shocks would you say per patient if you were to try to look over the course of time?
Yeah, so I would say anywhere from 1,000 to 3,000 is a good, average. And I've been using mine quite a bit and for the past 6 months, and I I think we're at 400,000 or something like that. So not even close.
For somebody that wants to move it around to different exam rooms, any difficulty with the mobility of it? Is it not too hard to pick it up and go?
No, it's a portable unit. Does need to be plugged in, but it's easy to move around and you can pick it up. It comes in a carrying case and you can pick it up, take it as well as the different gel pads and all of that.
As a practitioner, how nice is it to you if you have more than one modality coming from the same vendor so
Mhm.
that you have the same people with which to interface? How important is that for you?
So I look at that all the time because, if something goes on or we had for one of our chargers for our Activate shower wasn't working, able to call, had it replaced within 24 hours. It was all set. But I love that my staff knows that they could just call one number and or email one person and everything is taken care of. And we've fortunately have not had to do that very often. The charger was one of the first times, but it's great because you have that feedback, you have that education and everything. The team is familiar with how every component fits in, so it's lovely.
Terrific. I think we've pretty much covered the bases. Have I left anything out? Is there anything else that comes to mind that you think would be important to
No,
include?
no, I think that's all. Yeah, that's all I can think of.
Well, wonderful. Our intention for this, as you and I talked about before going on camera, is to help our reps across the world gain a
Hmm.
faster understanding of this device, and then also for the vets across the world to be able to say, ah, I see how this is different in this category, this category, this category. Ease of use, of course, is huge. Support, education, service are all very important. but ease of use and of course effectiveness.
Yes.
And you
Yes.
find that those three heads get the job done for you, that covers the waterfront.
Absolutely. Absolutely.
Well, it sounds like Impact Vet has found a good home in your practice,
Yes. Yes.
along with your ActiVet Pro, Shower, Alpha Vet, a nice family of modalities to help you make your patients better. And that's why you're here in the first place. We all love making these pets better.
Yes. Absolutely.